Hi, good morning everyone. This is Tom Kaya from King's College in London, interviewing for the ACC Fit on the Go video blog at the American College of Cardiology conference. Next to me I've got Dr. Mueller-Wieland, who will kindly give us in a nutshell a summary of his personal experience with the PCSK9 inhibitors.
Yes, hello, thank you very much. There are two issues which are very impressive for me. First of all, because for many years I'm interested in the effects of LDL cholesterol lowering and especially about liver metabolism. And so it's quite fascinating to have a new, not only target, but also understanding how the LDL receptor in the liver is regulated. And of course, it's a best example of translational medicine, how a target like PCSK9 finds its way into clinical application. In terms of clinical applications, it is very good to know that we have a further option to very effectively lower LDL cholesterol, and that is of course of clinical relevance for patients with very high cardiovascular risk. I'm mainly also interested in patients with diabetes and lipid metabolism, and patients with diabetes have a tremendous risk which is usually clinically underestimated. So we know, for example, from the STENO2 study that if you take patients with type 2 diabetes in the beginning of 50 and they have microalbuminuria, over the next 10 years they have a cardiovascular complication rate almost of 50%. So you could say the patient it's a 50-50 chance. And so we know that if we reduce the LDL cholesterol lowering effectively, and I think this is a very good option for PCSK9 inhibitors, and in this case antibodies, of course. It's injectable. And I think that my personal experience with the patients, that they are really happy, because we are talking about patients who survived myocardial infarction. We are talking about patients who are not that old, and they know they have a tremendous bad prognosis, and they are more than happy to inject a PCSK9 inhibitor, knowing that they can, as we know from this morning, just by principle, reduce cardiovascular risk.
I agree with you. What you've just mentioned, the translational model is a wonderful one that has worked in practice as well as in theory. Do you think there might be any downstream effects that we just haven't seen yet in the use, both in terms of safety or long-term outcomes that we couldn't monitor with the current monitoring period of 3 years?
Of course, always we have to consider these options. As far as we know at the moment from many trials, many thousands of patients in the clinical trials, that even the issue of neurocognitive dysfunction, as we will probably hear more about it tomorrow, is at least we have to look at it, but at the moment we do not find really anything of clinical relevance, which only means it's good for the moment and we have to look for the long term. Of course, we have to learn much more about PCSK9 as a molecule, not only in liver, but especially in other organs and cells. However, at the moment, regulation for the LDL receptor, this is a lot of basic science, seems to be fairly mainly related to the liver metabolism. And as far as we know from liver metabolism, the LDL receptor is regulated, but of course the LDL receptor in peripheral tissues is not as much regulated because you have enough LDL cholesterol in blood. And that's why very much like the wording from Eugene Braunwald, who says LDL is toxic and you have to lower it and just quit it like smoking.
Yes. And from a more European slant, where do you see the future of the new inhibitors? Do you think it's going to transition into clinical practice and at some point substitute even statin therapy, or do you think it's always going to stay an adjunct? Will patients demand being on an injectable therapy rather than a tablet form?
First of all, I think the statins are there, and it took many years. And I think we should not start a discussion at that moment, really, whether you take PCSK9 antibodies instead of the statin. At the moment, an escalating therapy. If you ask for the future, if you take the PCSK9 as a target and you can show that inhibiting this target safely long-term, but in an easy application and perhaps a very cheap application, I could imagine that it will open up new avenues, yes.
Excellent. Thank you very much for your thoughts today. This was Tom Kaya reporting for the ACC Fit on the Go blog. Found us on the YouTube website, youtube.com, Fits on the Go blog. Many thanks.